Nasal high flow therapy for primary respiratory support in preterm infants. Definition: in 2014, there were more than 380,000 preterm births in the United States, accounting for approximately 10% of all births that year. Preterm infants have a risk of the respiratory distress syndrome. The introduction of endotracheal ventilation has improved the survival rate among preterm infants, but is associated with an increased risk of complications, such as bronchopulmonary dysplasia.
Okay, we're going to be going over the nasal CPAP CBO today. Basically everything you have to know and what's expected of you to pass the CBO with the instructors or our team. So we're going to go over the machine first. All the basic buttons on it. So you can select your right here with this little knob, and you can see the flow. There's the alarm button. We'll go over that afterwards. There's what the FiO2 is actually reading. The CPAP level is. Yeah. So what we're going to go over first is basically what CPAP does. It's used to increase FRC, increase lung compliance, improves alveoli, and improves oxygenation. Apnea of prematurity, so it stimulates the baby to breathe. Respiratory distress syndrome, or RD.
Application in medicine. Clinicians aim to use non-invasive respiratory support to minimize the risk of such complications. The most widely used non-invasive approach, nasal continuous positive airway pressure (CPAP), has been shown to be an effective alternative to endotracheal ventilation as a primary respiratory support for preterm infants.
Welcome to the Draeger solution for non-invasive respiratory care. In this video, we will demonstrate the step-by-step instructions for the application of the BabyFlow Plus and all relevant accessory options. The BabyFlow Plus is available in 3 different lengths, which are classified as sizes small, medium, and large. It is available with the following accessory options: measurement tape to measure the infant's head and determine the appropriate size of headgear or disposable caps, sizing card for mask and prongs, headgear available in 6 sizes, disposable caps available in 8 sizes, prongs available in 11 sizes, mask available in 6 sizes. To begin, prepare the ventilator for use. 1. First perform a system check. 2. If the system passes the check, then set the device for use in NIV, non-invasive ventilation mode. 3. Once the mode is set, then perform the ventilator circuit check. In this video, we will show 2 different size patients, a neonate and a full-term infant, to demonstrate the application of the prongs and the mask, respectively, with the BabyFlow Plus. Start by using the measurement tape to check the head circumference of the patient and the sizing card to identify the appropriate prong size. Based on these measurements, choose the best fit headgear and prong option for the infant. Then choose the best BabyFlow Plus length out of the 3 offerings. Gently lift the patient's head and position the headgear underneath. Ensure that the headgear is centered and positioned directly on the hairline. For best positioning, avoid wrinkling the material. Notice the headgear is labeled with numbers to help assist you in securing the accessory correctly. First, take the middle strap, number 1, and put it over the patient's forehead. Then take strap number 2 and fold it over the top of strap 1. Then take strap number 3 and do the same. Then fold strap number 1 back and ensure that it sticks firmly with the Velcro. Now connect the prong with the selected BabyFlow Plus. Ensure that you avoid putting pressure on the patient's septum by placing the BabyFlow Plus at an appropriate angle. Take time to adjust and find the best placement. Take the selected prong and thread the number 4 headgear strap through one flap on the prong. Thread strap 5 through the flap on the opposite side of the prong. Position the prong in the nose of the patient and secure the BabyFlow Plus safely on the patient's forehead by using strap 6. Connect the BabyFlow Plus to the breathing circuit. At this point, therapy can begin. Now,
Pros and cons. The higher rate of treatment failure among infants receiving high-flow therapy in the study may reflect its reduced effectiveness in infants with surfactant-deficient lungs. Cons. Although high-flow therapy does provide some distending pressure, the higher, more consistent pressures produced during CPAP may account for the difference in treatment failure rates.
Hello, my name is Patrick Wilson, and I'm a pediatric critical care medicine physician who will be showing you how to set up and apply CPAP. The supplies that you need for setup include the CPAP machine, power cord for the CPAP machine, the air supply tubing, the oxygen adapters, the CPAP system package, which includes the following: inspiratory tubing, expiratory tubing, and the white adapter. You'll need a tape measure or ruler. You'll need a clean bottle. You'll require rubber bands. You'll need clean water. And finally, you'll need 5% acetic acid or vinegar. For CPAP application, you'll need a towel to help position the patient. You'll need suction to clear the airway, either elastic headband, cap, or hat to apply to the patient's head. You'll need 4 safety pins. You'll need the CPAP prongs, at least 2 rubber bands, and a lure lock to go on the CPAP prongs. First thing we're going to do is obtain a clean bottle. Apply the tape measure to the side of the bottle. The important thing is the 0 is at the top and the 7 is at the bottom.
Issue applied in Ecuador. In previous randomized trial comparing high-flow therapy with CPAP respiratory support after extubation in infants born at the gestational age of less than 32 weeks, we found that high-flow therapy was non-inferior to CPAP in preventing treatment failure.
on Monday, November 6th at 2 p.m. Eastern Time, Columbia University medical experts from Morgan Stanley Children's Hospital of New York Presbyterian will host a webcast discussion on the use of bubble CPAP therapy for newborns with respiratory distress syndrome. CPAP stands for Continuous Positive Airway Pressure. Bubble CPAP is a low-tech, labor-intensive therapy that is performed to prevent chronic lung disease.
Chronic lung disease is a serious problem. Not only does it prolong hospitalization and make the hospitalization that much more complex, placing the baby at risk for things like nosocomial infections, but chronic lung disease is also associated with poor neurodevelopmental outcomes. So avoiding chronic lung disease is a worthwhile goal.
Just minutes following the birth, pressurized oxygen is delivered through prongs in the baby's nose.
Any infant who's spontaneously breathing, irrespective of his birth weight or his postmenstrual age, he should be given a trial of nasal CPAP.
Bubble CPAP provides breathing assistance for babies as opposed to a machine doing the breathing for them. The Neonatal Intensive Care Unit at Morgan Stanley Children's Hospital of New York Presbyterian is a proven leader in this non-invasive technique and has among the lowest incidence of chronic lung disease in the world.
It's an expertise that one has to develop. And the expertise not only involves doctors, but also involves nurses and respiratory therapists. It's a team effort.
During the webcast, doctors will also discuss the operational functions of the hospital's CPAP system.
We use the oxygen blender to control the oxygen concentration for the gas sources. We immerse the distal tubing into the water to control the CPAP pressure. and we connect this CPAP circle to the patient with a Hudson nasal plug CPAP.
Anytime during the webcast, viewers can submit questions to the panel via email by clicking the mDirect Access button on their computer screen. You can watch this internet broadcast on Monday, November 6th at 2 p.m. Eastern Time, live from Morgan Stanley Children's Hospital of New York Presbyterian.
Conclusion. The study population was limited to preterm infants in neonatal intensive care units. Further studies are required to determine the safety and efficacy of high-flow therapy in non-tertiary facilities and resource-limited settings, as well as in term infants. The high-flow treatment results in a significantly higher rate of treatment failure than the CPAP, when used as a primary support to preterm infants with respiratory distress.